Members, good morning. We've formed quorum and is already the appointed time, and I call the meeting to order. This meeting was deferred from last Wednesday because of the black rainstorm warning. There are 6 papers for our consideration this morning. As at the last meeting, we have already considered 28 items. We've already approved $77.4782 billion, and under capital works projects, we have approved funding of $73.2117 billion. Among the 6 papers today, there are 5 are for upgrading the projects to Cat A, and the remaining is to raise the approved estimate of a project, and the total amount is $28.818 billion. If members approve all the items, then 34 projects have been approved in this session, amounting to $102.89 billion, and those that are project-related amount to $96.0325 billion. May I remind members that if there is any direct or indirect pecuniary interest, please declare interest in accordance with Rule 83A of our Rules of Procedure. Please make the relevant disclosure before speaking. And may I remind members our provisions for voting under Rule 84 of our ROP when direct pecuniary interest is involved. So if you'd like to speak on a particular item, please remember to press the request to speak button. The first item is Head 706, Capital Subventions and Major Systems and Equipment. Paper number PWSC 2013-14, number 5, Reprovisioning of Yaumatei Specialist Clinic at Queen Elizabeth Hospital. This proposes to upgrade 71 mm to Cat A at an estimated cost of $1,891.6 million in money of the day prices for the reprovisioning of Yaumatei Specialist Clinic at Queen Elizabeth Hospital. The administration consulted the Health Services Panel on the 18th of March this year. Present for this meeting, we have Professor Sophia Chen, the Secretary for Food and Health, and Mr. Leung Koon Kee, Director of Architectural Services. In the interest of time, I will not read out all the officials present, but anyway, there will be representatives from different bureaus. All right, do members have any questions? Please press the request to speak button. Mr. Wu Chi-wai, just a simple question. After reprovisioning, the total GFA will be 67,000 square meters. And then it is for reprovisioning of Yaumatei Specialist Clinic. I'd like to ask in the process, because I don't know what will be the total GFA, because an annex will be added. So can you please tell us the original floor area of the 2 facilities, and also the additional floor space after reprovisioning? And as a result, will there be extra space for possible expansion of services in the future, or to relieve the overcrowdedness of some of the facilities in the complex? In fact, the floor area can be found in the paper, but anyway, administration. Thank you, Mr. Wu, for your question. As pointed out in the paper, upon reprovisioning, that is in the new complex of QEH, the floor area will be higher. Some of the services will be enhanced, and the facilities will enjoy more space for improvement. Regarding total floor area, may I defer to Mr. Lee of the HA? Thank you. The new complex has a floor of about 25,000 square meters. Regarding the current Yaumatei Special Clinic, the current floor is about 8,400 square meters, so there will be roughly a threefold increase. Of course, I know the current area of Yaumatei Specialist Clinic, but I'm worried that the new building might not have been fully utilized. Thank you. Dr. Hung. Thank you. So the construction of the new block, the new block will be used in the coming few decades. And some of the services in the QEH complex will be provisioned in the new specialist outpatient clinic to make way for expansion of current services, and that will enhance the quality of services to patients as well. Dr. Fernando Zhou, I'd like to ask about barrier-free access. According to the plans, there will be a pedestrian walkway or footbridge. And on the ground floor, there will be a loading and unloading area. I'd like to know whether there is barrier-free access all the way from the point of embarking to the lift lobby. And regarding the pedestrian footbridge, I'd like to know whether there is barrier-free access all the way to the other side of the link bridge. The lift lobby is pink, just next to that entrance. Mr. Lee, please. Thank you, Chairman. The entrance lobby. Well, you see the yellow boxes, and they are the lifts that will land at all the floors of the new block. There will also be links to Block H using lifts. So we've considered that. But other than wheelchair users, so there will be clear signage, is that right? Yes, we will adhere to all the requirements. Any other questions, please? Mr. Wu Chi-wai. There is a great service demand at QEH. I'd like to know whether there will be extra provision for more loading, so that when necessary there can be more stories added to this block. Mr. Lee. Thank you. At QEH, there is height control, and we've already reached the limit. Further development will involve building additional blocks, but not vertical addition. If members have no questions, I'll put this item to the vote. Will those who are in favor please raise their hands? Those against, please raise their hands. I think the question is agreed by the majority of members present. I declare the paper endorsed. Right, the next item is PWSC 2013-14-6. The paper proposes to upgrade 76 mm to Cat A at an estimated cost of $12,985.5 million in money of the day prices for the construction of the Center of Excellence in Pediatrics. On the 15th of April, the administration consulted the Health Services Panel, and members were supportive of the funding application, and details of the discussions have been tabled. Present for this item, we have Dr. Kowloon, Secretary for Food and Health, Mr. Richard Yun, Permanent Secretary for Food and Health, the Director of Architectural Services, Project Director of ASC, as well as our colleagues from the Hospital Authority. Questions? Mr. Wu Chi-wai. Thank you. The local community would like to have a general hospital in Kai Tak as soon as possible. But of course, the Center of Excellence in Pediatrics is the first step, and therefore we are supportive of the proposal. I'd like to know the interface between the center and the future general hospital. So there are 3 sites here in Kai Tak, and one will be used for this center. We were told in the past that one of the sites was reserved for the construction of a private hospital. I'd like to ask whether all 3 sites have been allocated to HA for the public sector, please. I hope the administration can be succinct in its reply. After all, Mr. Wu, you're not asking a question directly relevant to this paper. I hope members can be more focused. Your question should have been asked at the Health Services panel. I'm just seeking a clarification. I see it. That's why I'm explaining that to you. So, administration, please be succinct in your reply. Thank you, administration. Thank you, Chairman. Yes, I will be brief. Our thinking is to use the remaining sites for medical use for the construction of a general hospital. Have all 3 sites been granted to the HA for public health services?
Well, yes, in principle, we have reserved it for hospital use. But in terms of integration, I think we'll still need to go through some internal process before we could come to this decision. Ms. Alice Mack, please. Thank you. I'd like to ask about the facilities. How many hospital beds would there be in each hospital ward? Because this hospital is for children only. For children who need to stay overnight, are there any facilities for parents? Because you know that in many public hospitals, there's only a chair next to the hospital. And even if you say the parents are allowed to stay, they can only sit next to the bed the whole night. And how are you going to stop diseases from spreading? Thank you. There's a range of hospital wards from private rooms to a hospital ward of 7 beds. And we are also providing facilities for parents to stay to accompany their children. How many beds would be given for parents in each room? Are they going to be just chairs like the public hospitals currently, or are you going to provide a bed? And how are you going to prevent infectious diseases from spreading? For private rooms, yes, the parents would be able to accompany their children. As for general wards, we would also provide quarters for parents to stay to accompany their children outside of the hospital ward. For infectious diseases, we do have wards specialized in preventing infectious diseases to try to prevent the diseases from spreading to other children. Thank you. Mr. Tam? A few years ago, the government talked about building a pediatric hospital, but nothing has been done until today. Well, is this going to be that children's hospital, or is there going to be another one in the future? And I think that, this name is really long, Center of Excellence in Pediatrics. Can it just be called the Children's Hospital instead? What is the consideration? Thank you. The Center of Excellence in Pediatrics will be this individual pediatric hospital, but as for the name, yes, we could consider the name later on. If you think that the name is too long, well, I also have the same feeling that the name might seem too long. We're going to discuss with the HA in the future to see whether we are going to change the name. But this Center of Excellence is kind of like a standard for many other hospitals overseas, but because you're saying that it's a Center of Excellence, so it must be world class, right? Otherwise, well, yes, we understand your concern. Do we really call it a Center of Excellence? We understand your meaning. But for the real name that is to be used in the future, we can discuss this in future. Well, I think there are some rooms for improvement. First, the restructuring of pediatrics under the HA. It seems that there is a lack of doctors and professionals in the pediatric sector. So you need to consider the resources put in this Center of Excellence in the future. Well, thank you. These questions are very important. You've pointed out the crux of the matter on the service structure and arrangements. Well, once this item is endorsed, HA will need to put in a lot of effort in restructuring pediatrics to see what kind of services would be conducted in the Center of Excellence. Resources is also a very important matter. Yes, we lack medical staff, especially pediatricians. Therefore, we'll need to use these few years to try to recruit more medical doctors. Well, there are many other centers that also provide a pediatric care, but they just don't have this name of Center of Excellence. Thank you. Mr. Tony Tse, I'll just like to clarify the cost. It's listed out under paragraph 10. Well, I think that actually you can see that you might want to tell us more about the preparation works, and there are also some figures on furniture and equipment. This might include CCTV systems. I'm not sure whether these would be considered under F&E or under building services works. As there's adjustment in fees, so we're talking about over 3 billion. Under para 12, you've listed out in detail the expenditure. Well, usually if you purchase furniture and equipment, you will need to pre-order it first. Well, you're talking about 3 billion now, and there might be an inflation of about 1% per year. And I'm sure that you also take into consideration the price increase such as building services works. So you would have a basic number of the percentage increase each year. Is that right? Well, I hope that you would keep those questions to the Finance Committee instead and not at the PWSC. Yes, Mr. Leung. Thank you for your question regarding the cost of the building services works. The cost of building services works in hospitals would be higher than other works because there is a higher standard for hospitals than in regular offices, because there are many regulations on ventilation and on air conditioning, etc. So the percentage is a bit higher. Well, this is even higher than the Yaumatei clinic. What's the difference between the two in terms of building services works? Well, I'm sure you know there might be some different requirements for hospitals and clinics. For these two projects, we'll consider the functional criteria and then we would come up with a percentage. Thank you. So how about the percentage of buying F&E? Would the adjustment in price be the same each year? For F&E, we would look at MOD, which is money of the day. Each year, we would adjust a percentage. We would estimate which year we will be using the money and then adjust it in accordance with MOD. Dr. Fernando Chang. I'm sure some children who need special care would be able to get services at the Center of Excellence in Pediatrics. I'm more concerned with barrier-free access transportation. Many children would need to reach the hospital via wheelchairs. This site is actually quite far away from public transportation. Parents would need to push a wheelchair user all the way from the public transportation to the hospital. I hope you would also consider the public transportation arrangements. Of course, we're talking about public works today and not on transportation. But I'm sure a transportation assessment has been done to consider how the public can use the service with barrier-free access. The closest road is actually Wai Yip Street, but it still doesn't solve the problem. So I think that you need to consider the transportation arrangements. If public transportation could not access the Center of Excellence, would there be something like shuttle buses, rehabilitation buses to help shuttle the patients to and from the hospital? Thank you. I'm not sure whether the administration could answer the question today, but I'm sure that they would bring the question back to the Transport Department to look into this matter to ensure that public transportation would be in line with this project, to make sure that there would be direct barrier-free access to the hospital. Thank you. Dr. Leung Ka-lau. Thank you. I think we've discussed it, and we're discussing health issues. So when we were planning for this Center of Excellence, it was considered that next to the site there would be a specialized center for neurology as well. Is this center of excellence going to be self-financed? Because originally there was to be a hospital, a general hospital next to it, so that they could share resources. Or you might say that the general hospital would be next to each other, but I remember hearing that there's actually a major road in between of the two hospitals. And you might actually need an ambulance to shuttle patients from one hospital to the other. So I want to know about the planning of the sites right now. Would there be sharing of resources with the general hospital next to it? Or is there any new updated information you'd like to share with us? Would this center be self-financed? In principle, this Center of Excellence in Pediatrics is actually independent hospital, so it should be self-contained. We have integrated hospitals to build a general hospital, and of course once we commission this hospital, resources should be shared, and we will need to try to plan these two projects together. So you are saying that there would be a general hospital next to the center, and you would consider the sharing of resources. You will be able to ensure strong communication between the two hospitals, that you wouldn't need to shuttle patients with an ambulance from one hospital to the other. I think, yes, we need to consider the logistics and to use the most efficient way. Well, but I cannot tell you right now what the method would be. So you're saying that I probably would need an ambulance. I think that you will need to consider this connection or this link in planning to ensure that patients would be able to be sent from one hospital to another. Ms. Sit-ho. Thank you, Chairman. This hospital is actually quite close to the Kai Tak cruise terminal. And recently we've discussed the pollution at the cruise terminal. On one hand, we welcome the development of the cruise industry. On the other hand, there would be very high emissions, such as particulate matter and also air pollution. So I would like to ask about the ventilation system. I understand that you're going to use the district cooling system, but I mean, no matter how you use the cooling system, you still need to suck in fresh air. And are you going to ensure that the particulate matter wouldn't be sucked in from the outside? Thank you.
In terms of air pollution, in our further design of the hospital, we will take note of the local conditions. For instance, fresh air intake, we will consider the location and orientation to ensure that fresh air intake can meet the required standards. We ensure that we can meet the requirements. Chairman, I suggest that there should be more communication among government departments. We visited the cruise terminal and I paid particular attention to the impact on air quality. We're told that the prevailing winds there will be southeasterlies. That means it will be blown towards Kowloon City, not Kwun Tong, or sometimes towards Kwun Tong. That's what I've been told by the officials there. And then when the cruisers are berthed, they will switch to shore electricity. But they have not decided the specifications yet. Mr. Michael Tian? Thank you, Chairman. Regarding the construction costs, so the area is 160,000 square meters. So if you minus the furniture and equipment, the unit price will be about 68,000 square meters. Tin Shui Wai Hospital will be commissioned around the same time, and the unit construction costs about $59,000 per square meters. So I'd like to know why is there a difference of 10,000 square meters in construction, because I already removed the furniture and equipment and facilities. So why is there such a big difference? And specialists, how many pediatric specialists do you expect in order to man the center? Because we're talking about very special illnesses, not just fever and other illnesses that can be taken care of by other hospitals. So how many pediatricians are you going to have in this center? So from day one, how many pediatricians will be redeployed from other hospitals, and what will be the shortfall as a result? So how can you ensure that you can reach the establishment? May I remind that these questions should be asked at the panel meeting. But since they've been asked, I will invite the administration to answer. I'll answer the second question first. The HA is projecting or estimating the manpower need. So, as I pointed out, pediatrics is among the specialties where there is acute manpower shortage in HA. So from now until the commissioning of the center, the HA has to fill up the vacancies. As regards how, there will be overall manpower planning to tackle that. Starting from now, the HA also has to consider consolidation of its pediatrics services. There's no ruling out that there will be deployment of doctors from the hospitals. Services will be consolidated for very highly specialized services. It's likely that they will be concentrated here, and such services might be relocated or reprovisioned from other hospitals to this center, and together that will also mean the specialists. This is quite a complicated task. All right. From now until the date of commissioning, would you say that you are already 80% or 90% up to your establishment? Well, there will still be a few years in between, and I'm quite confident that HA can fill the vacancies. What about the construction costs? Mr. Leung? Thank you. Construction costs. When we prepare the budget of an item, we'll compare it with comparable projects. So for this, we have we've done a comparison with the Tin Shui Wai Hospital. Paragraph 10 of the paper has a breakdown of capital cost from A to N. For items such as site works, basement works, piling works, where it really depends on the site conditions and also the plan itself. So we'll mainly use D and E, i.e. building works and building services works for our comparison. D, are you talking about B or D? D and E. Dog, D for dog. All right, that's better. Dog and elephant. D and E. We mainly use these two items for comparison. So for these two, it is particularly more expensive than that of Tin Shui Wai. No. We will base our budget on these two items. For site works or basement works, well, it's not really comparable. And how do these items compare with that of Tin Shui Wai? You talk about the same unit cost. Well, it is even cheaper than that of Tin Shui Wai. Oh, cheaper. The center is $5,882 per square foot, per square meters, and for Tin Shui Wai it's about 33,000. Well, I suggest that you ask these questions at the Finance Committee. Well, I was thinking that PWSC is about money. All right. You mean that FC is for money and PWSC is for the construction itself, and whether there is enough doctors, we should ask at the Health Services Panel. All right. Now I know the division of labor. So I'm going to ask the same questions at the FC meeting. I hope information will be available. Mr. Chen Yunhan, well, I'm a veteran here. I have to reorganize my thoughts. When you said that money is for FC and construction is PWSC, well, you learn something new every day. I hope officials can speak directly into the microphone. I support this center on the condition that a general hospital will be built. That's a promise from Dr. Ko, because the population of Fong Tai Shin is high, and there must be a general hospital here. This is not just a consensus of the local community, but the same about the whole society. All right, I'd like to talk about the design and the capital works. This is the first center of its kind in Hong Kong. What about greening? Will you start from rooftop, or will there be vertical greening? And you must have cute design to make it attractive to children. I know the place very well. I hope that you have to make it compatible, and you must ensure that it blend in with the environment. Patients and children are not happy when they're hospitalized, so you must make the environment pleasant. There must be room for children to move around. I have to stress that though they are patients, they are also children. So what will be the design of the center? We're able to achieve 30% greening. That is 30% of the site for the center. Will it be rooftop, vertical, or, well, ground level, vertical, and rooftop greening? Will you have vertical greening for all walls? Not all walls. We will select some of them for vertical greening. It's not feasible to cover all walls depending on the wind directions and so forth. Well, children hospitals in other places do not look like hospitals at all. Of course, I understand that if there is too much greening, that may not be feasible, but I hope you can have an open mind. It's important that there is greening and that the center can blend in with the environment. So 30% is important that you tell us whether it is just a vertical or a rooftop or a great greening. Because 200 trees is too few. I still have time. All right, what about places? A room for children to play and run around. Rooftop greening. Well, we have green roof. Well, I don't have the exact size here, area here. I can say that that would account for about 1/4 of our greening proposals, and vertical greening also 1/4. and the rest will be at grade greening. What about the design? The design, there will be 2 blocks. In between the 2 blocks, there will be an open space for greening, and then also greening at the entrance. And we will make it compatible with the surroundings, because just next to the site there is a channel, so the view is very open, and we'll ensure that there will be a spacious environment. And we'll adopt a plain design so that there will be natural illumination, and the greening outside can go into the interior so that patients and visitors can make cues or can enjoy the environment. All right. When a person is sick, regardless of his age, the environment is important. Since this is a children's hospital, you must have something interesting. Now, I was a patient once, and I think you cannot just rely on medication for recovery. The environment is important. Perhaps children like melons planted, grown there. You can make reference of overseas experience. Mr. Wu Chi-wai, Ms. Sit Ho, and Dr. Fernando Cheung, or rather, Madam Alice Mack. 3 minutes each, please. Mr. Wu Chi-wai. Dr. Ko told us that there would be communication or links with the future general hospital. I'd like to know whether you've really reserved room for that. And manpower arrangement, this is important. Although this is not the right forum to discuss it, I hope the relevant paper can be presented to us at the FC meeting. Manpower arrangement. And regarding the general hospital, perhaps I did not hear the secretary clearly. We expect that the general hospital will be a sizable one. If the remaining sites are not used for the entire general hospital, then perhaps there is a problem.
I think you've misunderstood. We are thinking of integrating the remaining site to build a general hospital. All these major works, we do need to have it approved in the government before we can do anything. But I think I've already made an announcement in advance before the process has been started. Mr. Lee, can you tell us about staff arrangements? Yes, this is a challenge for us. We have set up a steering committee to look into pediatric services. We are going to concentrate on tertiary hospital care services, and we are going to come up with some plans later on and to submit it to LegCo later on. Well, I think that there are not enough gynecologists in hospitals to open up gynecology department. We want to know early on staff arrangements because we don't want to see a building in place but without the adequate services provided. Ms. Alice Mack, Well, I'm sure yet there are going to be systems in preventing infectious and contagious diseases. And yes, there are going to be accommodation for parents. But I want to know the quantity of such facilities. Are you going to have a one room per building, or is the parent to be staying with the patient? So do you have further information on this? For F&E, although the term is furniture, are you under J? You said furniture and equipment. I don't see too many furniture. I see most of it is actually equipment, such as MRI equipment. Each hospital should have one MRI, but is this adequate? Dr. Lau, please. If you would like exact figures, I cannot provide you with them right now. We only, I could give you the figures after the meeting. How about the MRI? I want to ask about the control of infectious diseases, because I've been trying to go through the items under F&E, but I don't see any included. Maybe it's actually included under building works or building services works, but I cannot see any item on this. You are right. Yes, actually, this would not be reflected in F&E. Instead, it should be under building services works. Thank you. Ms. Ho, please. I'd like to follow up Dr. Fernando Chang's question on barrier-free access. Well, in the layout, you see that there are some barrier-free access roads, and you will be able to access the hospital via wheelchairs. I think that if you visited the cruise terminal, you would see that actually it's actually problematic to take a car there, because we had to go around Kowloon Bay, go through Mega Box, and then go through the loading and unloading area before we could reach the cruise terminal. I'm sure that these are only temporary arrangements. When the cruise terminal is commissioned, the vehicular access, the traffic lights would be more convenient. I remember last time it took us over half an hour after we exited the East Harbour Tunnel before we reached the cruise terminal. So I hope that vehicular access would be more convenient. I see that there's a carry dangerous goods go down near the hospital. And I understand that there shouldn't be any residential development near dangerous goods go down. Of course, an hospital is not a residential development, but there are many people who are actually staying there. So is there actually a requirement for a hospital not being so close to a dangerous goods go down? Mr. Leung, do you know about this? Or I don't have the detailed planning. There would be a public light bus stop and a taxi stand in the public hospital. Well, to my understanding, the carry dangerous goods go down would be reprovisioned. I'm sure, yes, there would be replanning, but would there be an overlap time in between? Would there be any contingency plan? I hope that when we bring this to the Finance Committee, the administration can give us some explanation on this, because the hospital would actually be very close to the carry dangerous goods go down. Yes, we would ask the administration to provide us with details in the FC. Mr. Albert Chan, please. Well, I think it's just the issue with the name. You claim that this is a center of excellence. So you're actually making yourself superior to other centers. Of course, everybody hopes that the name would be best, but you also need to consider the sentiments of other of staff at other centers. So are you going to make a name change? Dr. Ko? Yes, Dr. Ko said they hold an open attitude to the name, and there will probably be changes. Well, if there are no further questions, let us put this to a vote. For those who are in favor, please raise your hands. So those who are in objection to this, please raise your hands. So this item is endorsed. Thank you. Next item, PWSC 2013-14-6. So this is actually to upgrade the item to category A at an estimated cost of 317.5 million in money of the day prices for the construction of a classroom site at Site 1A4 Kai Tak Development, Kowloon. Members earlier said that they are in approval of this item, and there have been supplementary information made on February 14th of this year. We have with us today Mr. Hon Chi-kang, Director of Civil Engineering and Development, and also the Head of Civil Engineering and Development Department. Any questions from members? If there are no questions, let us put this to a vote. Mr. Wu Chi-wai, please. Thank you. I just want to point out one thing. So actually there's a North Apron is actually linking up to San Po Gong. I think that Chairman, I think that you're very clear we're also going to have the CKR, but you did not think about the overall planning of the whole area, how you can relieve the traffic congestion on Clearwater Bay Road and Nong Po Road. I hope that you would look into this item once again, and not only to look at the Kowloon Bay area route to reach the CKR. And I think that this would only give more pressure to the current traffic arrangements. Mr. Chen, please. Well, we have talked about this to the government and to the administration very often. So you actually there's a lot of problems with this. I think Mr. Wu Chi-wai brought out a very important issue. Well, we have the quarry mines up there, and I think many people would need to use the Clearwater Bay Road, and you will need to go through Peng Sek, Ao Chi Wan, and every morning you would see that it takes about 45 minutes to reach the urban area. People have been complaining to us for a long period of time, but there's been no solution. When I talk to the administration, I can say that there is not much we can do right now. But I agree with what Mr. Wu Chi-wai said. Well, why are we have so many roads? I have written a letter to Shunpo regarding this. But it's like that everything is surrounded around a T2. You have not done anything to alleviate the congestion. Miss Christine Law, well, she's in charge of the environment, not transport. Yes, I know she knows something. I'm just telling her. I criticized, the bureau. Why can't you just try to look into the overall planning? You cannot just add in a bridge sometimes and then just try to build another road. There's not too many places for us to do that. I don't want to say too much, but But I think that at this point we can only accept this paper. I just want to once again criticize that how can we really monitor, or how can we do something to try to enhance the overall area? Well, Chairman, I'm sure that you're very familiar with the district councils. I think I've followed up with the Kai Tak area development for 20 years. No, there's not much we can do right now. We're already at this point. What can we do? Thank you, Chairman. Ms. Christine Law is here for the next agenda item. Well, I just want her to hear it as well, because she always talks about air pollution. I think the Transport Department, all the departments, you need to also to look into these matters. You can't just try to resolve issues when they arise. If there are no other questions, well, please press the button if you would like to speak, Mr. Wu Chi-wei. Well, I'm not in too much of an objection on the paper, but I want the administration to give us a response on our viewpoint. I see that the Kai Tak development, actually there are different departments looking into the overall transportation arrangement. If it is not done properly, then it's not going to solve the issue raised by Ms. Chen Yun-han and I. Well, I think that you need to actually bring this to the Development Committee, because in that committee there would be related departments such as the Highways Department and Transport Department present. Today, however, we only have representatives from the CEDD, so they will not be able to provide you with a response on the transportation arrangements. Mr. Horn, please. Yes, I understand your concern. It has already been raised in the previous committee. We are applying for funding for the essential link between Sanpo Kong and the North Apron area of the Kai Tak Airport. This would link up with T2 and also to CKR. We are going to continue working with the related departments. Well, actually, we're not discussing CKR and T2 today, but with this infrastructure, basically, it would alleviate the traffic in that area. As to whether there would be congestion on some parts of the road, I'm not sure, but we could bring this back to the department. Ms. Chen Yun-han said that I think she was talking about the Anderson Road area, that with the development over at Anderson Road, there would be more people using the roads. Yes, it's actually would bring more traffic to the Wong Tai Sin district and not Kwun Tong. If you towards the north, I think that you really need to resolve the issue. I think you understand what I'm talking about. Well, I'm in support of this, but I just have some criticisms I would like to share with you. That's all.
Mr. Wu Chi-wei, any follow-up? No? Then if members have no other questions, I put this item to the vote. Will members who support this paper please raise their hands? Those against, please raise their hands. I think the question is endorsed. Thank you. Next. Head 705, Civil Engineering. The paper proposes to increase the approved project estimate of 45 CG by $1,284.1 million from $1,861.8 million to $3,145.9 million in money of the day prices for implementing Phase 3 Package A of the district cooling system at the Kai Tak development. On the 22nd of January this year, the development panel was consulted and members were supportive of the proposal. Details of the deliberations are tabled. Present for this item, we have Ms. Christine Low, Under Secretary for the Environment, Mrs. Dorothy Ma, PAS for the Environment, Mr. Alfred Sit, Deputy Director from Yaumatei, and also Mr. Lee Kwok Keung, Assistant Director. Mr. Albert Chen. I have always supported this item ever since its inception. However, I'm quite worried about the increase in cost. Should there be a review of the cost effectiveness and the overall cost of the projects? I know perhaps this is a bit late, but or because you're going to adopt the user pay principle, the developer and the occupants will have to foot the bill. So I'd like to know whether there is any information from the administration on the cost effectiveness and increase in cost of the project. Mr. Sit, thank you. We're very concerned about the escalating cost. We must have reasonable comparison with a conventional cooling system. Yes, because, well, the project prices here are higher. In fact, the prices for conventional system are also higher. So we believe that this system can still be cost effective, and I'm sure there will be savings. Well, we were presented with a comparison in the past. This system with the conventional system, the cost has been increased by more than twofold. So I'd like to know what will be the discrepancy in construction cost between the two types of systems. Well, we've compared the future charges with that of conventional system will still be a few percentage points lower than the conventional system. But you may overtake that in the future. Well, yes, there's the project cost is higher, but the cost for traditional air-cooled air conditioning systems will also increase. So I think we are still better than the traditional systems. I just like to note my concern because we're told that this would be 20% less expensive than the traditional systems. But for capital works projects, it's always like this. As you go on, there will usually be a budget overrun. This item has a livelihood implication. It's not just a simple capital works project. So even if the construction cost is higher than the traditional systems, I hope that the charges will not be more expensive. There can be some government subsidy to make up for the discrepancy in prices. So you have to set this policy earlier. If you want to recover cost, then you have to follow that. But I hope that the cost or the charges will not be higher than that of traditional systems. I hope that this policy can be decided now so that there will be no argument in the future. So if you heard Mr. Chen's comments, certainly, Chairman. Mr. Tony Tse, I will confine my questions to WEPS-related aspects. I agree with Mr. Albert Chen. Yes, the construction costs are much higher, and paras 7 and 8 have told us about the merits of the system. And then we've also got an item on the cost and charges. I hope there can be supplementary information on the technical aspect from the administration. We're told that construction costs can be reduced by 5 to 10% in the future. assuming that there will be non-residential developments here. Can there be a feasibility study taking into account all the benefits and also the charges to users? Now, the return period is about 30 years. According to the administration, what will be the lowest possible charges? And if the charges are not attractive, well, will it be something mandatory? Unless it is mandatory. Otherwise, if the charges are not attractive, then people will not use your system. I assume that the administration has done some assumptions and also some feasibility study. And I want from the administration, I understand that this system is mandatory. It will be used throughout the Kai-Tak development area. So all the pipes are already laid to each and every site in this area. Oh, let me supplement. I didn't know that it was something mandatory. Well, in fact, when some of the lots are disposed or auctioned, you will get less revenue from land sales, so you are cheating yourself. Mrs. Ma? Yes, we have done a comparison with traditional air-cooled air conditioning systems. So the MSD has compared with similar systems. Now this is a district system, and EMSD has done its very best to contain costs. We are quite confident that the construction cost will be lower than the traditional air-cooled air conditioning systems and individual water-cooled conditioning systems. As regards the charges, it will be set at a very competitive level in comparison with traditional air-cooled air conditioning systems and individual water-cooled air conditioning systems, using cooling towers respectively. Is it mandatory for the buildings here to use the district system in our land sales conditions? As recommended by legislators, we are going to add conditions in our land sales documents. Non-residential developments must be connected to this district cooling system. The EMSD will do its best to contain cost, and then we will also make reference to charges of traditional systems in the market. Chairman, I hope you don't mind. I will talk about the financial aspect. Please give us some figures, because the administration has been talking about the principles only. All right, very competitive. How competitive? For instance, we all know what is the electricity tariff. So do you have any figures for reference? I'll invite EMSD colleagues to supplement later. EMSD does a survey every year to look at the costs of water-cooled air conditioning systems, and the costs fluctuate from year to year. For this project, the earliest date for this system to be commissioned will be 2014. So the cost in 2014 will be purely hypothetical now, but our previous estimate was that it would be lower than that for individual water-cooled air conditioning systems using cooling towers. Yes, we are going to charge private users and when non-residential developments are proposed here, we will amend the relevant legislation to get LegCo's approval. The infrastructure, the cost of infrastructure, as well as the cost of traditional systems using cooling towers are changing all the time. So in due course, we will give a full comparison to LegCo. I think members' questions have a point. If you don't give us any reference figures here, then we're worried that the system might be very much more expensive than traditional systems, and then we may not support you, although we all support environmental protection principles. So please give us an estimate of the price level based on your construction cost for members' information. Please, Ms. Sit Ho. Thank you, Chairman. In the last LegCo, we focused our discussion on whether there would be monopoly here and whether the system was cost effective. Now we'll talk about phase 3A here. For the government buildings, so on and so forth. Well, this is just one money from the government going from one subhead to another. I'd like to know what will be the cost implications to the HA, because HA gets a lump sum grant from the administration. If more is spent on electricity, then less will be available for medication for patients. In case of system failure, is there any backup? I raised the concern about the air quality of the Center of Excellence for Pediatrics. Cooling is, of course, as important, because if in summer there is no air conditioning inside a ward, what will happen? And also refrigeration of the hospital is also at risk.
So is there any backup system to prevent system failure? And is there any backup system for the Center of Excellence itself? Thank you. I would address you on the reliability of the DCS. We, of course, were very concerned with the reliability of the DCS. Therefore, we have provided enough backup systems for the DCS. We have over 20 odd air conditioners, and there's also a backup that in case of a failure in any of the air conditioners, we would be able to provide a backup cooling system. And we also have different pipes and taps leading into the hospital. And taking reference from overseas experiences is actually a very reliable system, and this has been widely adopted in many countries. And we would use the DCS, and we are in support of having a backup cooling system. Now, due to the limitations in size, and we can see that actually DCS actually has an advantage, and it is actually more of a sustainable development. Also, like the administration to communicate with the HA in regards to the children's hospital, especially in terms of the cooling system. Well, you say that it's very reliable, but what if there is a system failure? It would really affect blood storage and the services provided to the patients. And I hope to see a paper on the impact this has on the current expenditure of the children's hospital. Mr. Wu Chi-wai, please. Oh yes, we are very clear with the environmental impact of the DCS. The children's hospital with the DCS, I'm sure will be able to save some building works cost. I think that we need to provide these figures to the public. When you submit the paper to the FC, you can also provide figures on some of the costs that you will be able to save with the implementation of the DCS. And how much can you actually save? You can actually provide us with the figures for our reference. Secondly, also like you to conduct a worst case scenario assessment. We want to see the return of investing so heavily in a DCS. Some of the individual residential developments may not want to be linked up with the DCS. So I hope that you would also give us a worst case scenario assessment for our reference. Thank you. Mrs. Ma, please. Thank you. In future, under the land purchase requirement, we would require private residential buildings to also be linked up with the DCS. We can actually lower 5 to 10% of the building works cost by linking up with the DCS. Because if they choose to use their own cooling system, actually their building costs would rise. Therefore, we believe that private development would also choose to be connected to the DCS. Buildings that are linked up with the DCS would be able to provide more space for other uses, such as rooftop greening instead. So we believe that there are many incentives for private development buildings to actually join the DCS. Thank you. The traditional air conditioners would be put on the rooftop or in the basement area. So, by using the DCS technology, individual buildings would be able to reduce air conditioning cost and also use the areas for installing air conditioners for other functions. We could help buildings save 5 to 10% of air conditioning costs. And it can save energy costs of up to 20%. So there's an upfront capital cost savings and at the same time 20% in energy savings. So that's actually very attractive for individual users. We have already put this into our land requirement purchase. We hope that with the incentive and by making this mandatory, all buildings and all development in the Kai Tak area will use our DCS. As I'm clear, I just hope that there would be higher transparency, that the government would show that by using DCS, how much capital costs we would save. It could show the advantages and the impact it has on savings. Thank you. Dr. Lo Wai Kwok. I am in support of new environmental technology. DCS is a new trial for us in Hong Kong. Electricity consumption would be reduced in comparison with using traditional air conditioning. But the cost in installing the DCS in Kai Tak area is quite high because Hong Kong is a very small piece of land. You might need to install this underground. I want to understand clearer. Would you also add in the depreciation in future, or would you treat this as a social investment? Well, I, of course, am not in objection of it being a social investment. It's actually a new experiment for us. Well, I'm not afraid that the system would fail. I know that the system is actually very mature. I just hope that all users would find it beneficial to use the DCS in the Kai Tak area. And I hope that you would give us figures on how you calculate the cost so that we'll be able to calculate the depreciation of the cooling system. Let's say the technology is very successful. More commercial users and individual users are willing to be linked up with the DCS. Would there be capacity to allow other users to join? Well, I think they can choose whether to join or not. Mr. Sit, we estimate that 10%, there would be a 10% additional capacity. Let's say there are more users, we could allow an extra 10% in capacity. That's already a very large number, because we are talking about 284 kilowatt. So 10% would megawatt. We're talking about 284 megawatt of refrigeration with a 10% increase. That's already a lot. So we would provide you the figures of comparison with traditional cooling system. So you're talking about usage of 30 years of depreciation. Thank you. So you say that there is a 10% extra capacity. You're talking about the buildings in that area, right? You are not going to have extra capacity to link up with other buildings in the area. Well, for commercial buildings, schools and government buildings in the Kai Tak area, they would all use this DCS. So let's say there are shopping malls or commercial buildings that would like to use DCS, you would not be able to provide such capacity for them. Am I right? Our calculation has already included all facilities in the Kai Tak area, 100% included. And we allow for an extra capacity of 10%. let's say we maximize the 10%. We would need to leave some room for further installation in the future. If you need to have a further increase, we will need to build more installations. 10% already is our max right now. We will try our best, but as you understand, there are limitations to engineering, so 10% right now is our max. Mr. Frankie Yik, you said you calculate depreciation at about 30%. Are you a bit too optimistic? Because would the government need to subsidize the system? Different facilities would have different depreciation. For major works such as this district cooling system, we believe that with proper maintenance, it would have a life expectancy of 30 years. Thank you. I hope so as well. If there are no further questions, we'll put this item to a vote. Oh, Mr. Lo Wai Kwok, let's say a housing estate really likes this DCS, they want to use it, but in accordance with their current design, you would not be able to provide them with this usage. Am I right? If the housing estate is really interested in using our cooling system, we would have this extra 10% to provide them with the system. But housing estates usually do not use central air conditioning. Our system is mainly aimed at facilities that provide a central cooling system. Housing estates usually they have individual air conditioners, so it might not be too appropriate for their usage. Thank you. Mr. Sheck? Just want more papers to submit to FC. Well, what would the figure be after using it for 30 years, and what would the figure be for after using it for 20 years, 15 years, etc.? Could you give us some figures to submit to FC? So if it's only for 15 years, of course, the cost would be higher. Well, we don't want to be in denial. You need to conduct a scenario testing. We want to know the figures for 15 years usage, 20 years usage, and 30 years usage. Thank you. So if there are no further questions, put this item to a vote. For those in favor, please raise your hands. For those who object, please raise your hands. This item is endorsed. Next agenda item.
Head 706, Highways. PWSC 2013-14-9. This paper recommends to upgrade 720TH to Cat A at an estimated cost of $4,320 million money of the day prices for widening of Tai Lo Highway, Fanning Highway between Island House Interchange and Fanning Stage 2. On the 19th of April, the administration consulted the Transport Services Panel, and the members were supportive of the proposal. Details of the discussion have been tabled, and that at the request of members, supplementary information was provided on the 21st of May. To answer members' questions, we have Mr. Yao Xingmo, Undersecretary for Transport and Housing, Deputy Secretary from the same bureau, and PAS, and as well as Director of Highways, Project Manager, and Chief Traffic Engineer. Questions, please. Ms. Emily Lau. Chairman. Regarding the pedestrian footbridges, some will be demolished for reprovisioning. What about barrier-free access? How will the facilities be provided? Director. Thank you. Thank you, Ms. Lau, for your question. The design of this project started a few years ago, And then, back then, there was no provision for barrier-free access. Let me say that these footbridges have ramps, so lifts were not needed back then. However, there is a new policy where there are ramps, lifts will also be provided. So there's been communication with the Tai Po District Council. We will gradually provide the lifts. So the project will be approved first so that we can widen the road first. And then in the coming few years, we will add lifts, or we will discuss with the District Council the addition of lifts for the footbridges. Upon completion, there will be both ramps and lifts. Thank you. Ms. Amrila, I hope that it's not just the target. There must be really lifts. Because after you are designing a new facility, and it should really comply with the requirements of barrier-free access, and the ramps are very long and pricey. If you can replace them with lifts, that would be much better. So is it right that there will both be ramps and lifts? In fact, not many people like to use the ramps. The distance is longer and they are steep. So what is the current policy? Should both be provided? And please be more specific. Don't talk about targets. Will you ensure that there will be barrier-free access for these footbridges? Yes, barrier-free access is a must. In the design, we had discussion with residents. Will we provision the ramps because they are there currently? And we'll discuss with residents whether with a lift the ramp can be dispensed with. However, members or residents would like to keep them because sometimes they would like to move large items back to their homes, and they must use the ramps so as to cross a total highway as well as the railway. All right, good. You ensure that lifts will be provided. Excellent. Is it true that both have to be provided, both ramps and lifts? Because I've seen similar footbridges with only either of the two. So please tell us the current policy. But as I said, the current policy is even if there are already ramps, we will add lifts to for the sake of the disabled and elderly. Now, we cannot add the lifts in one go because I said the design was made a few years ago, and the tendering exercise is already done and works can start at any time. We have discussed with the Tai Po District Council. They agree that ramps should be provided first, and in the coming few years, we will add lifts to the footbridges, and that is acceptable to the residents. All right. When will the lifts be completed? Will it be available together with the commissioning of the footbridges? Yes, our target is to have them ready. But it also depends on the design because lifts will be added and it all depends on the future design. First, we don't want to delay the commissioning of the road because this is important to the district council. Our final target is to have both the ramps and lifts. Can they be provided or can they be completed at the same time? Well, we can only do our best. Well, please try your best. You are still discussing with the district council, and please report to the council latest developments, and of course to the district council of Tai Po. Mr. Gary Chen, this question was asked at the transport panel meeting. However, they didn't have time to answer it. After the road is widened at the roundabout of Shanghai Kailing and also the Wohop Shek roundabout at morning peak hours. There is frequent traffic jams because it's moving from the slow lane to the fast lane. Will there be measures in the roundabouts to relieve traffic congestion there? Director. Thank you, Chairman. Together with the Transport Department, we have considered the capacity of the roundabout. If we just look at the figures, there should be sufficient capacity to accommodate the traffic. However, along Fanning Highway, we are carrying out noise barriers works. That means temporary traffic measures. This might have slowed down traffic a little bit. However, the works will be completed later this year or early next year. So by the time we reach the peak construction period for this item, the works will be over. So I'd like to follow up. Is it true that according to their projection, even with the road widened and attracting more traffic, there won't be any traffic congestion? And the congestion here is all because of the noise barriers works? Director, that's very correct. Thank you. Ms. Emily Lau. I'd like to ask about the funding. All right, for the footbridges that will cost $445 million, but that have not covered the barrier-free access provisions. We have to come back for money again for that? Director, Ms. Amlau, is true, is correct. We have not provided money for the lifts yet. But members may recall that we have dedicated funds for the construction of lifts so that we can add these facilities at the footbridges. So our intention is to use the specific funds for adding the lifts. Thank you. How much money are we talking about? So is it true that you don't have to get LegCo's approval in order to use money from that funding? The cost of detailed design, well, we have to find out later. But I'm sure money from the dedicated funds will be able to cover that, because we have the limit is $75 million that would be able to cover a few lifts. So we'll be able to complete that within $75 million. Do they have to come back to LegCo for approval? What do you mean by that dedicated funds for $75 million? Please remind me of the policy. Under the accessibility scheme for all pedestrians, well, we came to LegCo to apply for provision for each project. The maximum spending can be up to $75 million. Every year, we come to FC to apply for money for that year. If the project cost is lower than $75 million, then we can have money from that account for minor works. So they don't have to ask for approval. No, they will report to the development panel, so they don't have to come to FC. Every year, we come to FC for a lump sum. All right, I'm talking about the individual projects. At the beginning of each year, we have a detailed list covering, but then this item won't be in that list. Well, the money will be spent next year. So when we need the money, the list will cover this item. Chairman, I have no objection if you go to the panel, but I think in this subcommittee, you should give us an account of everything. Do you agree with me, Under Secretary? Well, the widening works phase 2 have already got ramps designed for the footbridges. Back then, when we did the design, the scheme for accessibility was not yet here. But since we have this in the current government, we have got money to install lifts at areas where they are needed. And we group all these projects together in getting money from LegCo. Still, LegCo's approval is needed, although it's a separate item from this project. Well, I get confused because I believe that when the scheme was announced, all new footbridges are supposed to have lifts. And I can't imagine why lifts have not been provided in the design of this project. I think what the director said was not very fair. You're going to demolish the footbridges first and then reprovision them, and lifts can only be added later. So why don't you add the lifts to this paper? Because it is our agreement that all new footbridges should have barrier-free access, including lifts, and lifts should have been built in this design. The director has already explained to you. Noted, but can that be included? Well, at the end of the day, lifts will be constructed, although it is not included in this paper, because when the project was designed, that scheme was not yet in place. Of course, I understand. But first, you build the footbridges first and install the lifts later. It will make it more complicated. At this stage, can that element be added? Under Secretary. This is a major project. Footbridges is only a very small element of the whole project. If we design the lifts, then they have to do the advanced works again. And if this is done, it will affect the implementation of the project. Well, in our concept, lifts will be included in the whole project. But we believe our handling at this moment will not delay the construction of the project. But we will still get the approval of the panel as well as the subcommittee for money.
Any supplement? Yes, we hope that there would be lifts at the footbridges, but during this transition period, the design was already made a few years ago, and we have already invited for tender. The tender did not include the lifts, and if we are to add in the lift and invite for new tenders, then the whole construction would be delayed. There are some technical difficulties. We have not yet completed the design, and if we are to add in lifts, how much money are we talking about? Who will be responsible for that? Could we really do that? There is no detailed planning. Without a detailed planning, it would be very difficult for us to bring this to FC to apply for additional funding. It would be very irresponsible for us to do so. There is a fund allocation mechanism, and we can actually try to start off this mechanism and to try to install this later on. We have already talked to the district council. They are in full understanding and are in support of this method. Thank you. So this would be the basis for further discussion in the future, and we can do that in the DC later on. If there are no other questions, I would like to put this to the vote. For those who are in favor, please raise your hands. For those who are in objection to this, please raise your hand. So this item is endorsed. Let us go to the last item. PWSC 2013-14-10 set 173TB to upgrade this item to Category A at an estimated cost of 74.3 million in money of the day prices for the extension of the Citic Tower footbridge to the Legislative Council complex at Tema. On March 19th and April 19th of this year, this has already been supported by the different committees, and papers have already been submitted. Today we have with us Ms. Helen Tang, Deputy Director of Administration, Ms. Jennifer Chen, Assistant Director of Administration, Mr. Lau Kowloon, Director of Highways, and also Project Director of Architectural Services Department and the Chief Highway Engineer of Highways Department. Ms. Ho, please. I'd just like to ask about the figure under paragraph 12. It said it is estimated that each year it will take about 100,000 for maintenance. I want to ask why we need to spend 100,000 each year, but then I understand it from after looking at the layout. Of course, there is lighting and also greening. Compared to the regular footbridges, I don't think that electrical should beautify it so much. I think that as long as it's functional, that's enough. I think we can do our own greening outside electrical. It should just look respectful and not spend 100,000 per year, because the footbridge for the general public is really very basic. I don't think we should spend so much money on beautifying it and on greening it. Well, I don't think electricity cost is that high. What are you going to use with the money? The whole government, including electrical, should be very clean. Sometimes we don't know it, but we spend a lot on trivial things like this. This is actually very dangerous for all of us. I hope you would explain to us why we need 100,000 per year for maintenance. Can we try to reduce the maintenance costs? Should this be answered by the Electrical Secretariat or someone else? Perhaps I could ask Mr. Lau to respond. Thank you. Thank you, Madam Ho, for your question. Greening the footbridge is not just to add in greening facilities on the footbridge. We are trying to be in support of the environment, and we are adding in greening facilities on many new footbridges. In the recent completion of the Chunwan footbridge, we added in greening concepts, and the general public really welcomed it. We're not doing it especially for electrical. We're not just using the money to maintain the greenery. What you mentioned just now, lighting is also essential. We also need to use some money to supervise and then to inspect the footbridge each year for safety issues. One part is the footbridge leading to electrical complex, and actually we would need to work together with the with the Architectural Services Department to maintain each year. Well, you know, the footbridge next door to us is so basic, so I really don't want to see the electrical one that nice. Miss Lau Wai-hing, please. Why I agree with what Madam Ho said. We know the footbridge leads to electrical, so would one part be very basic and the part right next to electrical, would that be suddenly very beautiful? Thank you for your question. I'm sure you are very familiar with the City Tower footbridge and you would use this every day. Oh, please just answer my question. The existing footbridge does not possess any greening facilities. For all new bridges, we hope to put in greening aspects. Thank you. Well, I don't think it's fair. Or you don't see anything all along, and then suddenly when you step in the electrical complex, it looks very nice. While for old footbridges, the government is also adding in greening aspects. Well, can you actually beautify the whole footbridge instead? Well, you know, as a resident, you are walking on this very bare footbridge and suddenly you reach electrical and it looks like it's suddenly a 4-star jump. Well, we understand your concern. We are going to talk to the LCSD and also to talk to the internal greening teams. I'm sure that we couldn't make any structural changes, but I'm sure that we could add in some potted plants so that the general public could also enjoy greenery. And it all really depends on the people flow as well to see whether this is actually appropriate. I think that if you were to green the footbridge, you should just cover it in entirety and not just part of it. We are asking for the footbridge. Well, we've actually asked for it for a few years, and you only built a footbridge leading to the government complex. So in future, for those who exit Admiralty, you'll be able to go up the escalator and then go on the footbridge and then reach Lechko directly. Well, currently it only links up to the government complex and there's actually a lift right next to it. The Admiralty station is also expanding for the South Island line, and part of the design is to install lifts to convenient the general public to reach the footbridge. So would that be done simultaneously? Well, maybe not. I think the construction of the footbridge would be much faster. Well, the deadline is different. For South Island line, or rather the Central Sharton link, it will be completed by 2018, and so I don't think the times will not completely match. For Harcourt Road linking to the government complex, there is a lift installed and you can use this at the current moment. There are still 2 other members who wish to speak. We only have 5 minutes left. Well, I hope we don't need to extend our session. Mr. Wu Chi-wai and Madam Ho, 3 minutes each, please. It's actually quite annoying to see potted plants as greenery, because if you see those plants on the streets, they actually look like garbage. I think the more ideal way to do it is to look at the interchange area near Choi Hong Estate. It's actually a kind of a vertical greening that links up the whole footbridge. I think that would be much more ideal, better than just putting a pot here and there. This I wholly insist on not doing it. I think we should look into greening, or maybe greening on vines from the ground lead up to the rooftop. I think that it would be much better than trying to put in plants, potted plants, because that would lead to increasing recurrent expenses. So I hope that you would take this into consideration. Thank you. Madam Ho, please. A very simple question. That basic part of the footbridge, leaks when it rains. It's really not ideal to have a very ugly part of the footbridge for the general public. Thank you. So I hope a representative from the Highways Department and the Architectural Services Department could look into this, and if there is leakage, please try to fix it. If there are no other questions, I will put this item to vote. For those in favor, please raise your hands. For those in objection, please raise your hand. This item is endorsed. We have discussed all agenda items today. I would like to ask members if any item should be brought up to the FC for further discussion. If not, I would notify the Secretariat. Thank you.